Jinsiangu is an intersex, transgender, and gender non-conforming based organization in Kenya. We are a national organization, and we also belong to the National Trans Advocacy Network, which is the larger coalition for trans programming in Kenya. So Jinsiangu basically started in 2012, and we basically started as a support group, right? Just a group of transgender persons coming together at that time and discussing the issues that they're facing in the community, in the society. Part of the work that Jinsiangu does is divided into a few areas, and that is health, that is advocacy, that is livelihoods, that is research, and that is knowledge generation and knowledge management. So some of the things that we do with regard to health is we work very closely with the Ministry of Health, and this has been made possible through various engagements that we've been doing with the Ministry of Health since 2017. And this has included building and generating evidence in partnership with the government. This has been developing a number of policies. One very good example is the National Transgender HIV guidelines, and this is something that is very proactive by the Ministry of Health because it provides a platform to which we can engage as transgender persons, as transgender organizations in Kenya with regard to access to comprehensive healthcare, just not HIV healthcare, as much as the HIV platform provides a space to do more advocacy in spaces and reach to other health areas. For example, HIV programming provides us a platform to talk about sexual reproductive health and rights for transgender persons, as this has been included in the strategic guidelines and the Kenya AIDS Strategic Framework 2, to which transgender persons have been included. And this basically talks about access to sexual reproductive health care for transgender persons. And having a policy such as this in place also enables us engage other stakeholders with regard to HIV, to sexual reproductive health. This is with regard to access to services. This is with regard to strengthening and or developing needed policies, as well as tools for data collection and data management, which are later used to create a more integrated and a more comprehensive service delivery package for transgender persons. With regard to gender affirming care and treatment, which is also another key area of our health work that we do. And here we have a number of partnerships with various specialists in the medical industry who provide an array of services that are needed for in the process of gender affirming services with regard to health services. We have referral pathways to which we refer our persons to, our community members to. We also provide a lot of information with regard to sensitizing, knowledge management, conducting research, and this is in partnership with other organizations in Kenya as well as the health department. With regard to mental health, it's basically we also partner with institutions that provide direct healthcare services, mental health care services. We also work in sensitizing mental health care providers, and we also work in creating platforms to which we can strengthen the referral systems and referral mechanisms of the same. But we also engage in policy level with regard to mental health, where Jinsiangu was part of the number of stakeholders who are part of the development and review and validation of the current Mental Health Act of Kenya. With regard to our mental health program, we also have a community-based sort of intervention where we have community members who have been trained to be persons who are key on identifying mental health issues within their peers, and also being able to give information, advice, and referrals to where they can get services, to which Jinsiangu has strengthened the partnerships within those spaces. We also conduct research, and here we work as the National Trans Network, but we also work with other organizations such as a Justice Initiative, where we just recently concluded a study, and this study was with regard to intersex persons, and it is called Not Broken, Do Not Fix, and it basically addresses the human rights violations that intersex children go through with regard to conversion therapy. We have also worked with other organizations such as LGBTIQ refugee organizations in Kenya, those who identify as intersex, trans, and gender non-conforming. And here we provide a number of services such as providing capacity building, and this is organizational development and system strengthening for LGBTIQ refugee-led organizations in in Kenya, as well as providing fiscal hosting, and also just basically working with them in integration, the process of integration of ITGNC refugees in Kenya. Our work is also centered around integrated services, and this is something that we do by ensuring that we strengthen the systems, the relationships with government systems at county level. This is with the Ministry of Education, the Ministry of Health, the Registrar of Departments, and this the Registrar of Births and Deaths, and this is with relation to access to legal recognition for ITGNC persons in terms of accessing name change, changing names in documents such as passports, education documents, etc. Within the same breadth of legal recognition, we also do litigation work where we are engaging the justice system and the court system in Kenya, trying to be able to just have a space or a judgment that is going to create a more inclusive registration process for ITGNC persons who are seeking legal recognition in Kenya. We do regional and international advocacy, where we work closely with our regional partners, such as we work within the space of the Pan-African ILGA. We are part of the Africa Trans Network, and we also engage heavily at the African Commission of Human and People's Rights, and we also engage within the UPR mechanisms through submitting shadow reports and also engaging in the conversations in Geneva. So in all the work that we do, we center a human rights approach and an integrated approach in changing social attitudes, social norms, which also now trickle up to changing laws, changing policies, and creating a conducive environment for intersex, transgender, and gender non-conforming persons in Kenya. We also have a gender non-conforming program, which is running for GNC persons in Kenya, and here we are at the process of basically identifying and being able to document the context for GNC persons in Kenya, so as to strengthen and be able to come up and develop comprehensive programs that directly meet their needs, outside having to look for spaces to fit GNC persons in intersex or trans programming, or the larger LGBTIQ acronym. That is basically Jinsiangu's work in a nutshell. But before I go, we also have this, what we're doing here, you and I, the media program, where we use media as a platform to which we do advocacy initiatives, we do visibility campaigns, and we also have a platform to share the lived realities and lived experiences of ITGNC persons and ensuring that they have a voice. And this looks like videos such as this looks such as social media engagements using new and old social media, as well as new and old media, either using traditional radio stations where we have people actually going and sharing their lived experiences and having conversations and debates to spark conversations in the larger society, to influence more conversations that drive toward norm change, informed opinions and informed notions of ITGNC persons, which influence change of attitude, which is also very, very key to the work that we do. And with that, I will say thank you very much for giving this video the few minutes you've given it, and I hope that is comprehensive to just give an overview of Jinsiangu work. Asante sana.